Europe is a big market and there's a lot of potential, but the markets are very fragmented. So each health system have their own rules, they have their specific populations and also the differences in how they bring care. And we only spoke a little bit about Germany because in Germany we have the DiGAs, which are digital health applications on prescription. And that's the first country that has allowed to bring it in a structured format into the market and allow DTX to get through a rigorous process of evaluation. And once you've been through that process, you're eligible to get reimbursed by all statutory health insurances. So that's a big step forward. And there's still some challenges, which we discussed, but it was a good discussion to see what the next steps can be. In France, we have a system that is just being introduced now, which is the PCAN system. The PCAN process will allow a very similar process like in Germany with the DiGAs. And also the UK, we've heard in the past 2 days, is implementing a lot more structure and a lot more process into getting DTX into a format that can be reimbursed on a wider scale. We also know that Austria is implementing a new pathway that is similar to Germany, which should be launched next year. So yeah, there's progress, and I think the bigger countries are now looking into it and finding ways on how to make DTX more acceptable in the populations. So I think there are probably 2 or 3 things that are still barriers that I think we cannot overcome, but we need to focus on. So one is the adoption. A lot of people still don't know what DTX are, digital health applications like DiGAs, how you get them, how you prescribe them, how you can benefit from them. And so there's a lot of education that we still need to do. Another thing is that we have a lot of stakeholders in the system with different interests, maybe, for example, insurances that want to have a cost benefit, if there are prescribers that want the patient health, but also they want to save time, so they want to reduce complexity. And then we have the patients that obviously want to improve their health, but there are a lot of offerings apart from evaluated digital health applications like DiGAs or DTX. So for them, it's also complex in understanding, what's really good for me. So getting all the stakeholders on board is also very important, and we're working on that as well. I think these are the first steps to really drive the adoption and make it more accepted in the industry. When we think about how to overcome the barrier of educating the entire population on DTX and how you can benefit from it, I think we need to work all together. That's also why we come together in this conference and meet with various stakeholders and representatives that are thinking about these challenges. And it's important to work together with the insurances. It's important to work together with the doctors. But first and foremost, it's obviously the main job of the manufacturers to educate the market and to communicate the benefits of the digital health applications in the system and how this can benefit patients with their health, how it can benefit the doctors with the resources, and how it can benefit with the resource efficiency, resource improvement, and how it can benefit the insurances with cost benefits.